Mm, Let's get started. So welcome everyone to our very first webinar for community pharmacy. I'm really excited to be talking to you all today, and yeah, we're really thankful that you've all joined us at kind of 6:30 on a Thursday evening to hear about how Accurx can support community pharmacy. And we've got a particular focus on today about how we can support delivering pharmacy first services. So just want to start off with some brief intros with some of the faces that you will see today. First of all, I'm Hannah Gledhill. I'm our market director for primary care. So I'm looking at how we kind of launch into pharmacy. I'm really excited to share what we're thinking with you today. I'll hand over to Margaret next.
Hi everyone, my name is Margaret. I'm one of the clinical leads here at Accurx, and I've been focusing on how we can support community pharmacy for the past few months. Really excited to be with you all today.
And we're also joined by two of our super users who are using Accurx in their pharmacies, who are going to tell you a little bit more about how they're doing that. So Paras, do you want to introduce yourself?
Hi everyone, my name is Paras. I'm a pharmacist working on behalf of Westbourne Pharmacy. We have a sort of group of pharmacies in Bedfordshire, and yeah, really excited to speak to you guys about how the software is really helping us in our pharmacies.
Thanks, Paras. And over to you, Kester.
Hiya, my name's Kester. I work at Chippenham Pharmacy and Health Clinic, which is an independent pharmacy based in Wiltshire. We're a distance selling pharmacy, so part of our stipulation for Pharmacy First is to do all of the pathway consultations via video calling. So that's primarily what I'll speak about today, although I will dip into a couple of other bits as well.
Thanks, Kester. Fab. So me and Margaret are going to do a very quick intro about Accurx. Margaret's going to do a full demo of the software. Then we'll hand over to Paras and Kester, hearing from them, and we will have time at the end to do questions and answers. So please do throw questions into the chat. We've got lots of other Accurx people on the call today who will start answering those, and then I'll pick up some of them live at the end as well. Great. So without further ado, we're Accurx. So we're on a mission to make patients healthier and healthcare staff happier through seamless communication. We've been on this mission for nearly 8 years now. And in that time, we've got nearly 250,000 users using us on a day-to-day basis in primary care organisations. So largely in GP practices. And GPs have told us that we've really changed the way that they deliver patient care. And as a result, nearly 80% of them would recommend Accurx to other healthcare professionals. And with the kind of climate in primary care, with kind of demand as high as ever, and the move to pharmacy first, we felt that actually our software, where it's kind of had some really big wins in GP, we actually felt that it could really support pharmacists. And so that's what we want to talk to you a bit about today. So this won't come as any surprise to you all. We know that there are some big challenges for community pharmacies at the moment. As I mentioned, demand is higher than ever for pharmacies, but also in the wider primary care system. And a lot of healthcare professionals spend time doing manual administrative tasks that they don't want to be doing, and all of that paired with a workforce that is kind of being stripped away, there is a risk that pharmacists are going to be burnt out. And we think we can help with some of these challenges. And as I mentioned, we've had a huge user base in GP, and these are some of the stats that they've reported to us from using our software. So using Accurx, they've been able to save over half an hour every single day by stripping out some of those manual tasks and using kind of seamless communication to contact their patients. Nearly 90% of users have reported that their workload feels a lot more manageable. This is one of my favorite stats, and I think hopefully this will resonate a lot in pharmacy. If this is something that can be achieved with our software, I'm sure we'll go a long way. And nearly 3/4 of our users have reported being happier in their job because they're not doing those tasks that are taking a lot of time and that don't feel very value add. So how do we kind of do all of that, and what is Accurx? So Accurx is a solution for communication needs. The kind of basics of it is that we give you quick and reliable two-way communication with patients via SMS or email. We also give you the ability to run video consultations with your patients. Kester's going to talk a little bit about that later. And we also give you a way to contact GPs easily and securely on the platform that they know and love. So as I mentioned before, we've got nearly 250,000 users in general practice on our platform that you can get in touch with. So without further ado, I'm going to hand over to Margaret, who's going to give us a bit of a demo and show us the detail of the product and how it works. So over to you, Margaret.
Thanks, Hannah. Okay, thanks everyone. So this is the landing page when you come into Accurx web. So once you've signed in, you will get here. In order to sign in on Hannah's previous slide, you just go to web.accurx.com and then you would sign in with your NHS accounts. And that literally takes 30 seconds. So if any of you want to do that as we're going along today, please feel welcome. But when you first come in, this is what you would see. So everything begins with a patient search because everything is tied to a specific patient encounter. So as you can see here, what you would need to do is either type in NHS number and date of birth, or you can search by the patient name. So I've recently searched for a patient, so Miss Julie Adams, so she comes up here below. And just to give you a flavor of what we can do, so we've got a few options that come up when you click the contact button. You can invite to video consultation, you can message patients, which we're going to talk about these two today. We're not going to be covering today, but some of you might be interested to know that you can actually request a GP record, and you can also message a GP practice directly. So this is one of our most loved features, but it's a feature that we're rolling out regionally. So if you're interested to know if you could use this in your region, then please contact us. And then we also have a patient profile view. So what I'm going to do to begin with is I'm going to go to the message patient option. And what you can see is it brings up this screen. So initially you can double check at the top who you're talking to, who the patient is, that the message is going to be sent to. You can also see that the mobile number has been pulled through via PDS. If for any reason you have a different number you want to contact in regards to the patient, or you want to message by email, that there is an option to do this here. And then you can see on the right-hand side that there's some template options and the questionnaire options, which I'll cover in a second. So when you have this big text box here, you can free text anything you want to say. So I'm just going to say test here. And at the bottom, on the bottom left, you can attach a file. So any file that you want to put, you can do that there, and that will be attached to the message. And if you wanted to as well, you can allow the patient to respond. So this can be really good when you're trying to arrange, like, whether the patient can come in at a certain time, or if you want to know how much medication they have in stock, or anything that you just need a quick reply that you maybe want to avoid doing the telephone, you can allow the patient to respond. If this box is not ticked, the patient will not be able to respond to your message. And then you can send. In terms of templates, we do have some preset templates. So there are some for video consultations, and there's some other sort of admin ones. But you might decide when you look through here that there isn't something that you want. If you find that, you can actually create a template from here. So for example, if I wanted to make a template for use with Pharmacy First, that was around sort of common infection and sort of self-help, you can easily make that. You can copy it from another source if you have, or you can just make up your own one. And you can see here I've included a link. So web links work here, but if you wanted to, you could attach a file, and that a file would always be presented with the template when you send it out. And if you see at the bottom, with Accurx, we have a lot of collaborative features. So it always gives you the option as to whether you want to just have that template for yourself, or if you want to share it with others. So if I press save, I can save and use it. And you can see that this template has already been pre-populated. And you can see now it shows in this custom template section. Next, I want to show you is the questionnaires. So we have a range of questionnaires that we've tailored for pharmacies. So we have a range of lifestyle and demographic questionnaires, which can maybe help you collect really quick information such as BMI, or do some sort of pre-screening before flu vaccinations or COVID vaccinations. And then we've also got some specific to Pharmacy First, and covering other services such as the new medicine service. So today I'm just going to preview the sore throat questionnaire. So just to double check, can everybody see the new window that's popped up?
Yeah, thanks, Margaret.
Perfect. So with our questionnaires, you can ask patients a range of questions, and we've got these pre-built, but if you have any ideas or other questionnaires that you want us to build, then you just let us know and then we can review that request. So this is a free text questionnaire, so the patient can respond how long they've had it. So I'm just going to fill this in and say 3 days. I'm going to ask whether the patient had a fever in the last 24 hours, so I could say no. Whether they have a cough, I could say yes. Blocked or runny nose, say no. So what you'll find is that a lot of these questionnaires are built around the Pharmacy First gateway criteria, trying to help you decide whether the patient actually meets the needs of the service in terms of dispensing medications, or actually if they just need sort of simple self-care advice. Again, there's some more questions here thinking about sort of red flags and other sorts of causes of rashes, which might be a bit more concerning, like scarlet fever. So the answer to this question, I'm going to say no. And then you can see within our questionnaires, you can actually insert pictures. So here we're talking about sort of the glands in the neck and where the tonsils are. And so we have inserted that image within this question. So at the moment, I'm going to say that my glands are not swollen and that my tonsils are not red, and that they don't have spots on them. If I'm able to take a clear picture of my throat, we can actually take that as part of the questionnaire. So the patient can upload up to 5 photos. And you can see as well, there's some tips on how to take a good photo. If the patient says they're not able to take a photo, it will just skip that question. And then similarly, we can ask if the patient has any sort of causes for an immune system. We can say no here. And again, there's a free text option to explain why the cause of the weakened immune system is there if it's present. So I could just say like on steroids. And then do you have any allergies? I could say no. And then again, we've got some questions asking whether the patient's pregnant. And then I think people have found this a really useful addition, just asking what times it's best to contact the patient in terms of follow-up to arrange an appointment for Pharmacy First. So I can say available between 1 to 2 p.m. And then what happens is the patient is able to review all the answers to their questions. If they want to go back and change anything, they can do that. And then once they've done that, it's submitted. And what you'll find is for each of our questionnaires, we have a page where we've got tailored safety netting advice. So for example, here it's talking about if there's any sort of red flag symptoms, it gives patients criteria as to when to call 999 or when to attend A&E. And then it gives some other times where perhaps actually if they're just slightly more unwell and doesn't need that level of attention, it might be better if they reach 111 or they contact their own GP directly instead of waiting for a response potentially. So there is a lot of safety netting advice that goes into our products, and we try and make sure that patients know what to do if things actually escalate. So I'll show you later on in the flow where that response has actually gone to. So this is sort of a brief summary of the messaging functionality. So you can see it can be used for lots of different things for Pharmacy First. You might want to use it to invite patients for review. You might want to use it to sort of gather information ahead of the consultation. And you might want to use it after consultation to give safety netting advice. And all of that can be done through the messaging here. Now, if I go back to the patient search, I'll just show you the patient profile because this is a really nice view. So here you can see all about Julie Adams. You can see some stuff to do with her GP practice. And again, that functionality, which we're not really focusing on today, but you could message her practice here. You can see all the conversations that you've had with Julie. And you can also see my conversations as well. So this is conversations that you've personally had with Julie. Those all conversations is the conversations you've had plus all the conversations that your colleagues have had with Julie. Then you can see at the top, you've still got these 3 quick action buttons. And next, what I wanted to do was cover a bit about the video consultation. So with the video consultation, it's a really secure platform that GPs used a lot during COVID. So we have a lot of confidence that it works well. And on one link, you can actually share it if you needed to, not saying that you should do this, but you can share it with up to 200 people and the link would still work for a video consultation. And it's a unique link that's sent for each patient. And when you come to use the video consultation, you can see that it pre-populates with this sort of standard Accurx template for video consultation. But actually, if you had made some, they would show here. Or if you decide you want to make your own template for video consultation, you can do this here. and you could call it Pharmacy First invitation, or you could call it whatever else you wanted. And then again, you can see that you can set that template to be the default, or you could share it with your organization. And as part of this, you might even want to give some guidance about Pharmacy First or something else that you might attach as part of that template. So that would go there. Okay, so the next thing I want to do is just show you a little bit about patient lists. So this is one of the sort of features that sometimes people miss. So with Accurx Web at the moment, we don't integrate with any PMRs such as ProScript, but one thing you can do to mitigate against this and to make your life smoother is that rather than searching for a patient each time you need to contact them, you can actually add them as part of a list. So for example, if I view this list, which I've just called Pharmacy First follow-up, you can see I've got Miss Julie Adams here. And you can see that maybe every time I wanted to message a patient in relation to Pharmacy First, I could search for them here, and then they would populate in this list. And then if you need to, you can workflow this list. So what I mean by that is that you can remove patients from the list and keep it as a dynamic list, or you could have it as a static list where you can keep track of your work. To edit a list name, you do this at the top here. And then if you wanted to, again, you can share your list with a colleague or within your organization. So this is just a really handy trick, which sometimes people don't know about, and it can really help you to manage your patients in your workflow. The next thing I want to show you is our inbox. So this is where the responses from patients come into. So you can see in my inbox, I've only got one message, which is from Julie Adams, and she said hello. And then from here, I have the option to respond back. So I could say, thank you. And you can see that when you send messages, you can see the different delivery status, whether it's been sent and whether it's been delivered in the bottom with the ticks. If you want to do for any reason, you could get a copy of the messages that you've sent or the patient sent back, and you copy that into another system. Typically, what we recommend at Accurx is working with inbox 0. So once you've got this message here, you can actually mark it as done, and then that would disappear, and you can see that you've got no open conversations. And to find any conversations you've previously marked as done, you can just check in your done folder. The other thing that's really helpful is that you can see sent and scheduled messages. So any messages you've previously sent, you can see here. And then, as I mentioned before, you've got the option to see all conversations, including your messages and the messages of your colleagues. Next, I'm going to skip to the questionnaire folder. So you can see earlier I completed that sore throat questionnaire, and it's gone into a folder called Sore Throat Pharmacy First. And if I click on this, I can see that the patient's actually submitted this, and I can easily read through their answers. So I can see the question and I can see the response. And again, I can get a copy or I can reply to this from here. Again, we typically recommend that you mark this as done. If a patient doesn't respond, typically within the window which we have, which is 7 days, then you would get this person did not complete timeouts. And then so that can really help you to know what to do with the patient. But typically with Pharmacy First, I would imagine if a patient hasn't responded within a set time, maybe a couple of hours, you might be picking up the phone to contact them anyway. A couple of things I just wanted to point out, which I thought could be helpful, is that in organization and organization settings, that's where you can find your templates. And from here, you can edit any templates that you've previously made, or you could delete them. You can also see any templates you made for the video consultations underneath here. There's also another tab which allows you just to double check which ones you have shared as well, so they will be visible here. And the final thing I wanted to show you, which a lot of people are not sure, is if you go under Accounts and then you click on Account Settings, you can actually edit your signature. So with Accurx Web, trying to be in line with NHS guidance around sort of security and accessing patient data, it's recommended that you sign up to Accurx with your personal NHS account, but some people don't want to sign off as themselves. They might want to sign off as their pharmacy name. So you can actually do this by changing your signature. So I could change this to Accurx Pharmacy, and then from now on, all my messages would say that at the end. So that's a really quick whistle-stop tour of Accurx in our web-based platform. So I hope that's been really helpful. I'm just going to hand back over to Hannah now.
Thanks, Margaret. Great. So I'm going to introduce you now to Paras, who will be talking about how they're using patient messaging and questionnaires. So over to you, Paras.
Yeah, perfect. No, thank you so much for inviting me to speak to you guys today. I guess, yeah, by seeing that all firsthand, you can see how easy this sort of software is to use. And yeah, truly sort of thankful for Accurx because it has sort of really saved us a lot of time in our pharmacies. So when we first started, we didn't actually have sort of a text messaging format for our patients. We introduced Accurx to our pharmacies in January this year. And yeah, it's sort of proven to show like we can do a lot with the software, and the fact that they've been able to sort of develop a lot of stuff over a long period, sort of a short period of time, it's really encouraging for us as a profession. Um, so yeah, I guess the messaging function, what we used it for initially was what the standard things which you'd use. So to message patients about picking up their medication, maybe if there's stock issues, letting the patients know that yeah, this medication wasn't available. Are you happy for us to go to your GP to sort of speak to them on behalf of that? The other sort of alternative before that was whether we sort of called the patient or send them an email, and sort of you all know how sort of time consuming that can be. So by having that platform here to be able to do that with our patients, it's been really beneficial. As well, there's some sort of things with sort of text messaging platforms. So there's that whole element, you need to get everyone's telephone numbers available, and it can take a lot of time to do all of that. With Accurx, the fact that it's sort of linked up to the NHS number, which you enter in, it just makes that life a lot easier. So less sort of admin time involved with that. And yeah, I guess the thing which sort of attracts us most to it all is the fact that it's free. A lot of these sort of text messaging platforms which you might use do actually sort of charge you per text, but with this sort of simple messaging format, it is a free service. So what makes Accurx extra special? I guess you saw from Margaret sort of show there's that two-way messaging function. It's easy for patients to reply, and you can also sort of send out the attachment. So that's really helpful. And then, yeah, that second element of the questionnaire. So those questionnaires have actually gone a really sort of long way for us, managing patient time and making sure that we are sort of seeing patients with for example, pharmacy first, they need to meet the sort of gateway criteria for us to get that funding to be able to support them. A lot of patients we're seeing might come in, and it's really hard to manage to see whether they've met that gateway point or not. So having this sort of questionnaire, which they fill out on their phone, you either sort of send it to them before they come to the pharmacy, or even you can send it to them in the pharmacy as well. It just sort of helps sort of identify what their sort of condition is and what the symptoms are. And yeah, just sort of helps make sure you can sort of manage that time effectively. Once you get that sort of questionnaire come back, that thing which Margaret mentioned about the timing, so the patient sort of lets us know what time suits them best. That's really, really helpful because you can put that back into your own calendar, and then the pharmacist can manage their time effectively. What a lot of us as pharmacists are finding at the moment, we've got so much to do, and being able to manage that time is really difficult. And that's what's leading to sort of burnout and other stuff like that. And yeah, just sort of last couple of things. It's really sort of encouraging that sort of Accurx team have managed to put all this together within about 2 months. They're sort of putting a lot more focus into pharmacy services. I'm sure sort of the software is going to do a lot more. So yeah, if you haven't tried out the software already, do give it a go. And yeah, no, really thankful for inviting me to speak to you guys today.
Thanks, Paris. And over to you, Kester.
Hi, everyone. Thank you for having me. As I mentioned earlier, I work at a distance selling pharmacy. So it's slightly different for me in that most of my pharmacy first referrals are direct GP referrals. So I wouldn't necessarily have to use the questionnaire function. So I suppose it's just adapting your practice to what you need, because with a GP referral, obviously I can still put through a minor illness claim if people don't make the gateway point. So I think it's just being sort of smart with which functions you use. I hadn't picked a piece of software to use within about a week of Pharmacy First going live, which was obviously quite a worry. But logged into Accurx, had some experience with it, having worked in GP practice before. And it was literally 30 seconds to set up and get started with, and it's very intuitive. So I would strongly encourage you to use it, whether you're using it for videos or just for the more sort of run-of-the-mill text messaging side of things. In terms of how I use it for video consultations and managing my time, I tend to get probably somewhere between 15 and 25 referrals a day, and they tend to come through mostly in the morning. So I sort of scan through. I can then send out a text message about a phone call for people who don't necessarily fit Pharmacy First, and then for people who are likely to fit Pharmacy First, I send them a message with a rough time frame on to expect a video call. I think that was really important for me starting off with it, because initially I started with just sending a message and hoping people would respond to the video call, because you have to follow a link rather than actually getting called like a FaceTime call. So I was finding that I was actually taking some time to do that, and if people weren't responding, it was taking longer. So having that sort of time frame for patients and explaining that it will be a link rather than a phone call massively increased the uptake of people who were sort of there and ready to go when I tried to start the video calls with them. So finding out a good way of using it has actually made it really, really efficient, which has been great.
Just let us know.
In terms of how I actually then use the video calls when they're there, you send a message, it tells you the message has been sent, delivered, read, I think, and then it tells you that the patient's setting up their device to do the call. So you get a tick list of each one, which is again really helpful because you can see if the message hasn't been opened. I normally tend to wait about 3 or 4 minutes. If it hasn't been opened, then I have a template set up to say, we couldn't reach on the video call. Please reply to this message or call the pharmacy number to set up another time. I've also got some safety netting on that template about calling the GP or 111 if we're not able to get back to them. So again, that template function is really useful because it's a good coverall for, you know, if you don't manage to speak to somebody or can't leave a message, and you can just give them advice about where to go to next if you're not able to speak to them and not able to get back round to them in the day, which obviously doing sort of between 15 and 25 a day, depending on what else I'm up to. I don't necessarily have the chance to get back round to everybody if they've not been able to answer the phone a couple of times. And I'd say the only other thing about the video calls, obviously there are things outside Pharmacy First that are useful to see. So things like infected toenails, infected fingernails, rashes, and things like inhaler technique for NMS. It's rare that you can get a snapshot of the patient sort of using those devices unless you plan it very specifically. Whereas if you can book in a sort of early morning call, then often people will take their doses there on the phone with you, and you can get a visual assessment of how well that's going rather than just listening to a description, which often patients will know what they're doing, but sometimes it's good to see it in the flesh as well. I think that's pretty much everything from me for now.
Great. Thanks so much, Kester. So hopefully you found that helpful, hearing a bit more from Paris and Kester about how they're actually using this in practice in their pharmacies. Great. So we've got about 10 minutes left. There's been lots of questions coming in, which is great. Do keep kind of firing them through, and the team are working hard to respond to them. There are just a couple that we will pick up live. And just to say, if you have any questions that aren't answered, do feel free to get in touch with our support team. So we've got a live user support team who are amazing, and they can answer any questions that you may have. And you can find them by following by clicking on the little green chatbot icon at the bottom right hand of your screen whenever you're on whenever you're on Accurx. So do get in touch if we don't answer everything here. And the other route to get in contact with us is by emailing us at pharmacy@accurx.com. Great. So just a couple of questions. There's a couple of questions about the cost. So I'll kind of touch on that first. So everything that you've seen today is free. As I mentioned, we're kind of new launching into pharmacy, and we want to understand kind of what is useful and where we can bring value. And we think the best way to do that is to give you our software and see what you do with it. The functionality that you have today will remain free, and we are always looking to build newer products, and it might be that some of our newer products will be paid for in the future. So we operate a kind of freemium model in for all of our organizations, but the functionality that you've got today is free. There have been a couple of questions about the questionnaires that we've showed you. So the questionnaires that Margaret have showed are currently in pilot phase. But after this webinar, everyone that's registered, we're going to send you the link for you to get early access to those questionnaires as well. So you can sign up to the waiting list, and we can switch you on with them in no time. There are a couple of questions that I might hand over to you, Margaret, about the usage of Message GP. So one of the questions is, can you tell if a message sent to general practice has been read or seen?
Yes. So although we didn't go through it in detail today, on the Message GP functionality, we show you how many people in the practice have been online today. And then when you actually send a message, you'll see the status change, a bit like WhatsApp. So we'll say that it's been sent, so it's been delivered, and then we'll say it's been read. And you'll see it kind of changing colors, and you'll see the time it's been read. And then on the GP end, they will get a notification that comes in, which they can sort of deal with that message really smoothly. They can workflow it to another person if they think someone else is better to deal with it, or they can actually save the message that you sent them direct to record. So it's got a lot of use cases, and we've been working really hard with lots of ICBs who want to use this for things like IP Pathfinder or out of stock pilots. We've got quite a lot going on in that area, so definitely watch the space.
Thanks, Margaret. And another similar question, can you just talk a little bit about whether the GP practice has to be using Accurx or how pharmacies can get access to this feature?
So that's a really good question. So hopefully Hannah mentioned beforehand that we've got a really good uptake with general practice. There's very few ICBs where we've got low usage. And even when the ICB is procured, other products still choose to use us because we have a sort of a free version as well for GPs to use. And so if the GP is using Accurx and they have that feature enabled, you'll be able to see that Message GP button that you saw on my screen pop up. However, if the GP practice has asked to not use that feature, or if they're not using us at all, then that feature typically is not enabled. And so at the moment, to get access, you need to contact support, and then we'll let you know in your area how many GPs are using it. But for most areas, it's completely fine, but there are a couple of areas where usage is a bit on the lower side. So but then we kind of give you advice on next steps. So definitely, if you've got sort of pharmacy leads in your ICB, or you think this is a really helpful tool, it would be a good idea to have a chat with them about it.
Thanks, Margaret. Another question is around integration. So are we going to be integrating with PMR softwares like Titan, ProScript, etc.? So we integrate with, we have integrated with the GP medical records, so System 1 and EMIS. So we do have a background in integrations, and we are kind of exploring what integrations we might need to do in pharmacy to make sure that we're delivering value. But we haven't really fully started any of these conversations yet. So that's just kind of where we're at the moment. But Margaret showed a couple of kind of features that can support streamlining the way that you work without that integration. So things like pulling through a batch list of patients into your patient list, so that you've kind of always got those patients there that you can quickly message and refer back to. And it's quite easy to kind of get a copy of any of the questionnaires and the patient responses that you've got to then go and copy that over into the different systems that you have. Fab. I'm just scrolling through some of the questions. Oh yeah, a couple of other questions talk about I guess people who are across lots of different pharmacies, maybe owners of kind of small and medium chains. Margaret, do you want to talk a little bit about the best way to kind of set up those organizations and how they're able to access the communication across those different pharmacies?
Yeah, of course. I'll do a bit of intro, then actually hand over to Paris, because Paris has actually done this because he's got a bit of a small chain. So typically what we would suggest is that you sign up with your individual account, but then as part of your account, you can be part of multiple organizations. And then that way, if you are overseeing different organizations on different days, you just want to see what's going on, you can actually control and have a look at sort of the inboxes. You can kind of set the templates up for each one. And we've got like some workspace functionality as well, where you can easily add users into your organization or remove them or archive them too. So in a snapshot, it's very possible. We even had one chain of 80 or 90 sign up the other day, which Catherine sorted out, one of my colleagues who's just answering some of the questions. So it's very, 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 very doable. But Paris, I don't know how you want to sort of tell other people from your experience how it was for you setting up with your chain.
Yeah, no, really easy, and it's really beneficial to have that sort of. It's kind of like a head office function, from that one account, because I can sort of monitor what's going on at each of the pharmacies and just make sure everything's getting responded to in a timely manner. And as well, yeah, sort of just if we need to, for example, when you showed you can assign a message to a colleague, for example, if I need to, I can just go through the questionnaires as an example and assign that to someone who's on duty that day, just to make sure it's sort of getting picked up on their end.
Fab. Thank you, Paris. Another question probably for one of you, Paris or Kester. How would you do a new medicine service using Accurx?
Do you want to go or?
No, yeah, I don't mind. Yeah, I can do it. So yeah, we actually use NMS through Accurx quite a bit. So yeah, just so you guys know, as you already know, but there's 3 stages to NMS. The first one is the engagement stage, which is done via the sort of the sort of patient being in the pharmacy, or you're sort of having that consent process there. But then where Accurx comes in, they've got the questionnaire set up for the intervention stage, and then for the follow-up stage as well. So technically, as part of the service spec, you can't use this questionnaire as the sort of the follow-up, but it kind of has all the questions there. So it just makes it a lot easier for pharmacy teams. So what we do at our pharmacies, the intervention stage is sort of 7 days after they've signed up and started taking the medication. So what we do, we go through these engagement forms, send out the questionnaire to the patients after 7 days, and then that gives the patient a bit of time to answer the questions, and then sort of provide that back to the pharmacy. Benefits you have there is, yeah, you can sort of see how the sort of patient's getting on with their medication. And I guess it gives the pharmacist a little bit of time to sort of maybe research about certain sort of expectations or concerns the patient might have. So when you're going into that consultation to do the sort of interventional follow-up stage, the pharmacist is a little bit more planned and can sort of give a much more sort of consolidated consultation with the patient. As well, a really good benefit is that sort of whole thing about timing, because a lot of time when you're trying to call your patient for NMS, you're finding that they're not answering, and trying to follow up with that is sometimes really difficult. So the fact that they've mentioned the time which suits them best, you book that into your calendar, then hopefully they're going to answer that time through. I don't know if Kester, you had anything to add on to that?
Not particularly, other than with the nature of how we work, obviously, is distance selling, or you could use it for someone perhaps who's had medication collected on their behalf, if it is something like an inhaler or alendronic acid, maybe something that requires a little bit of technique to take it. That might be good to sort of set up a video call through Accurx just to get them started. So I would sometimes use that. And I think, to be honest, I've used I've used email for NMS before, where patients have preferred that, where they've been going on holiday and that sort of thing. So I think it's a fairly natural transition over from that. And I mean, you can use the questionnaires, or you can do sort of free type if you want it to be a little, give the patient a little bit more scope, or you only really want to focus in on one or two things rather than giving them a full questionnaire. I guess it depends on the patient and the medication and your judgment of what you want to use, really. But yeah, I think the only thing extra for me would be that initial video consult, given the nature of the pharmacy I work at.
Great, thanks both. And just in the final couple of minutes, there are a couple of questions about kind of farm outcomes, and does this replace farm outcomes? So we are not currently one of the pharmacy first IT solutions kind of assured by NHS. So at the moment, you would kind of receive your referrals through farm outcomes, and then you would use our tool to kind of do your patient messaging and your patient communication about that. So we see ourselves as a kind of supplement to support delivering that service. And in terms of the message GP functionality, we really see the use case there being those kind of ad hoc, the queries about medication, as Margaret mentioned, they're out of stock responses. So anything that is a kind of ad hoc message that you need to get to the GP really quickly, that's really where our functionality comes in. And the final thing to answer, a couple of questions about people have heard about our batch messaging functionality. So this is, again, something that we're piloting. And as I mentioned before about how we're working out, we're kind of building new features, and those might be our premium features. Batch messaging is likely to be one of our premium features, but we are currently running free pilots for that for the time being. So again, if you get in touch with us at pharmacy@accurx.com, we can sort that out for you, and we'll be following up with all these links after the webinar. So thank you all so much for joining. It was amazing attendance. We've had over 100 people here today, and thanks so much for all your questions. Please do kind of log on to accurx.com/pharmacy. You will see a bunch of case studies there from other pharmacists, and you will find all the relevant links to kind of sign up and get started. So once again, thank you so much, Paris and Kester, for joining us. Really loved having you here, and hopefully see you all at another webinar soon.